Hi, my name is Dr. Jonathan Chong from Dr. Tan and Partners, and today we'll be dispelling some common myths about the COVID-19 vaccine. At present, there is substantial data from clinical trials that supports the safety and efficacy of these vaccines. Robust clinical trials involving tens of thousands of patients were conducted in progressive phases that established the safety of these vaccines. In Singapore, multiple safety checks were put in place before the vaccines were rolled out to our population. The Health Sciences Authority applies high international standards in their evaluation of these vaccines to ensure that they are safe and effective for our population. Additionally, an expert committee comprising 18 scientists and clinicians was also formed to advise the government on COVID-19 vaccines. As such, all these measures work cohesively to ensure that the vaccines were safe and effective for use in our population. Another common myth is that COVID-19 vaccination can negatively affect fertility. However, at present, there is currently no vaccine, including COVID-19 vaccines, that have been shown to negatively affect fertility. In Singapore, the prevailing Ministry of Health guidelines allow for couples who are planning for pregnancy to receive the COVID-19 vaccine. However, it is also advised that they consider deferring conception for 1 month after receiving the second dose of their COVID-19 vaccine out of an abundance of caution. Mothers who are breastfeeding are able to receive the vaccine. However, they should also consider deferring breastfeeding for 5 to 7 days thereafter. However, at present, there is insufficient data to allow for vaccination in pregnant women who should not receive the vaccine until more data is available. One popular myth is that patients with chronic medical conditions should not receive the COVID-19 vaccine. Patients with chronic medical illnesses like diabetes, high cholesterol, and high blood pressure are at an increased risk of developing severe disease and complications from COVID-19 infections. As such, vaccination in such patients is recommended not only for personal protection, but also to protect their loved ones. Additionally, the study populations in both the Pfizer-BioNTech and Moderna Phase 3 clinical trials included patients with these medical conditions who were at an increased risk of developing serious disease and even higher rates of mortality from COVID-19 infections. In all these studies, it was found that there were no safety concerns in this subgroup of patients. However, patients with certain medical conditions, like those with severely compromised immune systems, or patients with a history of severe allergic reactions, should not receive the COVID-19 vaccine at this time. If in doubt, please speak with a doctor to discuss the suitability for your COVID-19 vaccine. The last popular myth is that COVID-19 vaccines can give people COVID-19. However, this is simply not possible due to the nature of the vaccines. Both the Pfizer-BioNTech and Moderna vaccines that are currently approved for use in Singapore are messenger RNA vaccines that do not contain any live virus. Messenger RNA vaccines carry instructions to our immune system cells that allows our cells to formulate the spike protein of the COVID-19 virus. This in turn stimulates an immune system response to form antibodies against COVID-19 to protect the person who has been vaccinated. The spike proteins are incapable of causing COVID-19 infections, and as such, it is impossible for the vaccine to give a patient COVID-19 infection. In addition, the mRNA instructions only persist in the body for 2 days after vaccines, after which they are naturally broken down by the body. Additionally, the vaccine mRNA never enters the DNA of our cells, where our genetic material is kept. If you would like to find out more or have a consultation about your vaccination options, please visit www.dtabclinic.com to contact us for a consultation.